The topic of this video is tick-borne relapsing fever. So what is tick-borne relapsing fever? Tick-borne relapsing fever is a rare vector-borne bacterial infection. It is characterized by recurring episodes of fever and nonspecific symptoms such as myalgia, headaches, and shaking chills. So what is the organism that is responsible for tick-borne relapsing fever? The Borrelia species is the organism that causes tick-borne relapsing fever in humans. It is transmitted to humans by exposure to an infected ornithodoros tick that live in the nests of small animals such as squirrels and chipmunks. Ornithodoros soft ticks are the main vectors that transmit the disease to humans. These ticks emerge at night and feed for a brief amount of time. Borrelia bacteria can go through the process of antigenic variation, which gives the bacteria the ability to create repetitive cycles of the disease. This occurs when there is a continuous presence of new outer surface proteins. So where and why does this disease persist? Tick-borne relapsing fever is found in discrete areas throughout the world. The mountainous areas of North America, plateau regions of Mexico, Central and South America, the Mediterranean, Central Asia, and throughout Africa. There are several Borrelia species that can cause tick-borne relapsing fever in different parts of the world. B. recurrentis and Borrelia dutani are two Borrelia species that have high fatality rates from relapsing fever. B. dutani is found in East Africa and is transmitted by the soft tick Ornithodoros movada, while B. recurrentis can be found in South America, Europe, Asia, and especially Africa. In North America, the two most common pathogens of tick-borne relapsing fever are Borrelia hermsii and Borrelia turricatii. There have also been reports of Borrelia dugesi and B. turricatii in Mexico. Most cases of tick-borne relapsing fever occur in the summer months when people are vacationing and sleeping in places where there are rodent infestations such as cabins or rustic buildings. This disease is prevalent in temperate and tropical areas, and the bacteria can grow at temperatures between 33 and 35 degrees Celsius. So how does this disease transmit to humans? Tick-borne relapsing fever occurs when Borrelia bacteria are transmitted to humans by exposure to the bite of an infected Ornithodoros soft tick. A soft tick's bite is brief and painless and usually lasts about half an hour. Humans come into contact with the soft ticks when sleeping in rodent-infested cabins or rustic buildings. Tick-borne relapsing fever can be caused by multiple species of Borrelia and are usually linked with specific species of ticks. Ornithodoros hermsii can be found at high altitudes and are linked to ground squirrels or chipmunks. Ornithodoros porcari can be found at lower altitudes where they inhabit caves and burrows. Ornithodoros turricata are located in caves and in ground squirrel and prairie dog burrows in the plain regions of the Southwest. So as you can see, this is a general timeline that shows the relapse intervals of tick-borne relapsing fever. It starts off with the bite of an infected soft tick. The incubation period is about 7 days, and after that it cycles between symptomatic periods of about 3 days and ephemeral or non-symptomatic periods of about 7 days. And without antibiotic treatment, this process can repeat several times. So what are the symptoms of this disease? The main symptoms of tick-borne relapsing fever are usually headache, high fever, and muscle and joint aches. Other symptoms that can occur are nausea, vomiting, diarrhea, dizziness, shaking chills, and myalgia. There are also risk factors that make individuals more susceptible to getting this disease. Those risk factors include living in relatively high humid or tropical areas, low socioeconomic status, overcrowding, and poor personal hygiene. So what are we doing about this disease now? Diagnosing this disease is rather difficult and it involves a collaboration between interpersonal management teams of different healthcare professionals. There are currently no vaccinations for any of the Borrelia species that are linked to tick-borne relapsing fever. But to avoid tick-borne relapsing fever, here are some preventative measures that need to be exercised for people with recreational or outdoor exposure in these areas. Using insect repellent to prevent tick bites that contain DEET or permethrin. Avoid sleeping in rodent-infested buildings and removing rodent nesting to decrease the risk of infection. Wearing long trousers that tuck into socks or boots, as well as wearing long-sleeved shirts or layers. Installing screens wherever you can to avoid being bitten by ticks, mosquitoes, or sandflies. And finally, patient education to stress the importance of good personal hygiene and sterilization of clothing and bedding. So now we'll be looking at the treatment options for this disease. Borrelia bacteria are sensitive to antibiotics, so this is the primary treatment option for tick-borne relapsing fever. Adults are treated using doxycycline of 100 mg a day for 7 to 10 days as a course of therapy. Children under 8 years old and pregnant women are treated using erythromycin or penicillin. It is also common to get Jarisch-Herxheimer reaction. This reaction begins approximately 1 to 4 hours after the first treatment with antibiotics, and the symptoms can be severe. The global impact. Tick-borne relapsing fever can affect many different places throughout the world. In the regions of North America, Central and South America, Mexico, the Mediterranean, Asia, and especially Africa. There are different species of Borrelia that are associated with different species of the Ornithodoros tick found throughout the globe. People will travel to these areas to use preventative measures in order to avoid getting tick-borne relapsing fever. Thank you for watching, and we hope you enjoyed this presentation on tick-borne relapsing fever.